How to Master USMLE Step when Visual Pathology Content. Are you ready to tackle the visual pathology content on the United States Medical Licensing Examination Step 1? This part of the exam can feel daunting, but with the right approach, you can master it. Let's break down how to effectively prepare for this crucial section. Start by building a solid foundation in pathology concepts related to organ systems. The exam is organized by these systems, so understanding how they work is essential. Familiarizing yourself with normal anatomy and histology will help you identify pathological changes. Many questions on step when requiring you to distinguish between normal and abnormal specimens, making this knowledge vital. Next, practice interpreting a variety of visual materials. This includes gross pathology images that show changes in organs, microscopic slides, and clinical images like dermatologic or ophthalmologic findings. Use question banks and review resources that include annotated images and explanations. This will reinforce your recognition skills. The more you see high-yield images, the better your pattern recognition and diagnostic reasoning will become. Focus on common diseases that have distinctive visual features. Pay attention to neoplasms, inflammatory conditions, and congenital abnormalities. It is also important to consider the clinical and laboratory data presented alongside images. The exam often tests your ability to integrate visual findings with clinical scenarios, so this is a key area to concentrate on. Utilize the official United States Medical Licensing Examination Step 1 content outline as a guide. This document highlights important study topics and the types of visual content you may encounter, such as gross and microscopic pathology specimens. Aligning your study with the exam's expectations will help you feel more prepared. Incorporate active learning techniques into your study routine. Self-quizzing with image-based questions, teaching peers, and creating visual flashcards can reinforce your memory. These methods will help you transfer knowledge to exam conditions effectively. Finally, simulate exam conditions by practicing with timed blocks of questions that include visual pathology items. This will help you build stamina and become familiar with the exam format, including the computer interface and question styles. By combining a strong conceptual foundation, systematic practice with diverse visual materials, and strategic use of official content guidelines, you can master the visual pathology content needed for success on the United States Medical Licensing Examination, Step 1.